I know, it's the last thing you want to think about. But consider the COVID-19 pandemic with me for a moment. I'd invite you to think not about the virus, but about what it has exposed. There's something going on and it needs to be sorted out. That's a quote from Robert Anderson, Chief of Mortality Statistics at the CDC. Our unspoken horror story in this country is how we treat people in nursing homes, especially those suffering from dementia. Worldwide, more than 50 million people are living with dementia. And that number will double every 20 years. Nurses are abandoning the profession, leaving nursing homes understaffed. People can make better money at Walmart than they can by caring for our most vulnerable. This is on track to get worse and spiral into a crisis that touches everyone and damages everything. Society can therefore choose one of three paths. First, we can slouch towards robot care, which isn't real care because it isn't human. Second, we could slide into euthanasia, solving a social problem by killing those who need care. The third option is to move with urgency to restore human dignity. A challenging path, but one with clear social and moral benefits and one with a strong pre-existing foundation. This is what my new book is about. Grappling with a spiraling crisis before it consumes us, asking hard questions, and finding the right way forward.
Hello, my name is Greg Metzger, part of the team at New City Press. I want to welcome you on behalf of all the groups co-sponsoring this event. The 4 sponsoring dioceses, San Francisco, New York, Orange, California, and Baltimore, together with the Catholic Health Association, ArchCare, and the National Review Institute. We are all pleased that you can join us on live or on tape for this important discussion. The millions of people who suffer dementia are not statistics. They are our grandmas and grandpas, our moms and dads, our siblings, our friends. We know that many of you joining us today are actively involved in creative, compassionate care for the elderly. And it is for their dignity that Charles Camosy has written his new book with New City Press. And it's for that same reason that we're gathered here today for this conversation. To guide this conversation, we are honored to have Kathyrn Jean Lopez. Kathyrn is Senior Fellow at the National Review Institute, where she directs their Center for Religion, Culture, and Civil Society. She is a passionate defender of human dignity and the chair of the Pro-Life Commission of the New York Diocese. Kathyrn, thank you so much for partnering with us, and I'm happy to hand things over to you now.
Thank you, Greg. And thank you everyone who's joining us. Today we're going to have a conversation with Charlie Camosy and then bring in Bishop Kevin Vann from Orange County in California, Sister Constance Veit from the Little Sisters of the Poor, and an occupational therapist, and our second occupational therapist, Erin Younkins from the Diocese of Baltimore. Charlie Camosy, I wish that video that we just watched was overly dramatic. Unfortunately, what you lay out in your book makes clear that it's not. Can you talk a little bit about the crisis that we are already in?
Yeah, so even if we leave aside, oh, hi, Kathyrn. Even if we leave aside the what the future holds, and we shouldn't, because it will spiral into a crisis and consume us. I don't need to tell many people on this panel and on this call, frankly, that we're already in a crisis. Oftentimes, this population is kind of just warehoused, isolated, over-medicated, especially with antipsychotics, and essentially just left to die in a warehouse. Beyond that, though, if we think about what's coming next, the lack of resources that we're putting into caring for this population and the slouch towards assisted suicide we're seeing more generally in the West, I really think that's where we need to focus our attention in a major way. And if you think that's too alarmist or dramatic, I just want to draw everyone's attention to an article actually in National Review Online by Wesley Smith, which he titled "Bioethicists Propose Time-Delayed Suicide Implant for Dementia Patients." This was written by a couple of well-known bioethicists in a well-known journal called the Hastings Center Report. Mm-hmm. And I don't need to tell you much more than beyond the title what that is about. But if I'm right, it's just a matter of time, and I lay this out in some detail in the book. It's just a matter of time before we either slouch towards robot care and or assisted suicide and euthanasia. And let me just say two other quick things too. The panel's title is about mapping the church's response. And I just have to say, one of my favorite parts of researching this book was to see, I think it's fair to say, in all due humility, the glorious parts of the church's response to these kinds of emergencies throughout history is one of the reasons I'm most proud to be a Roman Catholic, frankly. I go into some detail in the book, for instance, about how there are some historians that say the early church went from a kind of persecuted sect to a much more influential group of folks, in part because of how they responded to medical emergencies. And if we just look throughout history, whether we're talking about the plagues in the late Middle Ages, early modern period, if we're looking at the history of nursing and responding, especially in the US, to other pandemics, a civil war, and even our current pandemic, we've just been at the heart of this in a really major way.
Charlie, can you talk a little bit about the experience of, at the beginning of COVID, you were sounding a lot of warnings about how the most vulnerable, specifically the elderly in a particular way, would be treated if we had shortages of ventilators and things like that. You heard a lot of stories. Can you share a little bit about how real this was?
Yeah.
And
go ahead, sorry.
And remains.
Yeah. Well, again, there are so many people on this call right now who are even more aware of this than I am. But my book before this one was called Resisting Throwaway Culture, and it's hard to imagine a better example of throwaway culture, which how we, in relation to how we treated those who are in nursing homes, and especially 50% of those have some kind of dementia. How we treated folks with dementia was essentially a dumping ground in many states for patients they wanted to use to free up space in various hospitals. And we just learned a couple days ago, actually, that it looks like the Department of Justice is dropping a major part of its investigation into that horrific example of throwaway culture. So that's made headlines now for the better part of a year and a half, and we're all probably aware of that. But there were even other examples of just horrific ways that they were treated during the pandemic. In some cases, they were simply discarded because they wanted to make room for COVID positive patients from whom they could get more reimbursement dollars. There was a terrible case in LA of a person who was essentially kicked out of a nursing home with dementia, who was found wandering the streets of LA. In another example, someone was allowed to simply exit their nursing home in the middle of the cold. They were found frozen to death the next morning. You could go on and on, but really what the pandemic did, it kind of shone a spotlight on things that were already there, things that were already present. And here's a key point. The pandemic has offered us an opportunity to finally start talking about these things openly and honestly in a very public way. One of my friends, actually, who I quote in the book, made this simple and profound point. She happens to serve as acting head of learning and development for dementia services at the University of Stirling in Scotland. And she said, quote, that a process exists which strips away the core of one's personality, leaving the individual at the mercy of others who may or may not subscribe to upholding and reinforcing their uniqueness, is terrifying to consider. I can quickly shut a conversation down simply by telling people what I do for a living. Most often it is easier not to recognize that stage of the disease process even exists, end quote. So the fact that we're all here, and I want to thank the panelists in particular and all of you for being on this call. And those of you who are listening afterwards in a recorded video, thank you for being part of this conversation, because even the fact that we're having it at all, I would consider to be a huge win.
Well, with that, let me start bringing in our panelists. Bishop Kevin Vann, you not only are the ordinary of Orange in California, but you have leadership in the Catholic Conference in California, and you have a medical background. Can you talk a little bit about that and react to Charlie?
Charlie and I have visited about this a number of times, and what he says really resonates with my own personal and ministerial experience. As a parish priest, I would have nursing home masses, visit nursing home patients, hospital patients. And even back then, I'm talking about the early 80s now, people were just in the halls, and they were medicated, and I really tried to talk to them and get a response from them, so I could see that firsthand. My own mother, who was a nurse and an OB nurse, was a fierce advocate for my grandmother. My grandmother was in a nursing home in Springfield, Illinois, and it was really awful. My mother went directly to the administration and advocated for my grandmother, and we got her in a better situation. But there were so many people that had nobody to advocate for them. And as a parish priest, when you talk to folks who are sick, dying, or nursing home folks, you just see that there was a real lack of really human interaction, human care, which had the potential to really kind of bring these people back. So.
And how concerned are you about both the shortage that Charlie is talking about and the euthanasia, the assisted suicide possibilities here? It's of course legal in California, as well as many other states.
Leading up to the physician-assisted suicide bills, it had really fought very fiercely here in California for a number of years, and it really was kind of held at bay. Well, through some, political maneuvering, the bill passed. And so in response to that, the Catholic bishops and the Catholic Health Association initiated what's called the Caring for the Human Person. So to really strengthen and shore up our ministries to folks who are vulnerable, so they would not have to be susceptible to this kind of thing. So that has really made a lot of progress, and I'm involved with that. But in fact, now there's another bill back this year to take away whatever safeguards were there. It's like, oh, we'll promise we'll do this if you pass it, but no, all the next bill is to do all safeguards. So it's a real, and we've got people organized for that. So it's a real concern. But I would say that the caring for the whole person, which the Catholic Health Association has really helped with, really tries to be proactive and get everybody involved, a lot of parishioners and other folks involved before it becomes critical.
And the education piece is so important. So many people don't know what the resources are. And so thank you for doing that. Sister Constance Veit, could you please join us and react a little bit from your experience caring for the elderly poor, for people who don't know who the Little Sisters of the Poor are, maybe let them know too.
Sure, Kathyrn, thank you. So our congregation is an international congregation of women religious, and our only apostolate or mission around the world is to care for the needy elderly. And we do so in homes, which are usually set up as multi-levels of care. So for instance, I live here in Washington, D.C., and we have an apartment wing for low-income seniors who are still independent. We have an assisted living floor, and we have a floor of nursing care residents who are the most infirm and in need of care. So, and that's really how all of our homes function. And the idea being that the elderly come to live with us when they still have some level of autonomy and independence, and then they transition through our home until God takes them to himself. So, they progress into higher levels of care as time goes on. So I have to say that in reading Charles's book, I was taken aback because I'm a little bit sheltered from much of what he was talking about, because I give care in our own homes. And of course, we don't see a lot of, witness directly the things he was talking about, but it's still of great concern to me. And, I am aware of these things. We've had assisted suicide has been legal in Washington, D.C. for at least 2 or 3 years now. And so it makes us more vigilant when we're admitting residents to the home, to make it clear to them and their families, that we follow church teaching fully, and that, we will not participate in any acts contrary to church teaching. But in the context of the pandemic, something that Bishop Vann said resonated with me, in that he remembers, and as do I, because he remembers seeing the elderly just sitting in the hallway, medicated, nobody really interacting with them. That's really the era that I started working with Little Sisters as a high school volunteer, and then in college, was an era when that was pretty much what went on in nursing homes. And there wasn't so much life enrichment or engagement or activity, meaningful activity going on. Nowadays, there's really an emphasis on that. And yet I hate to admit that even in our homes, to some degree, that was the first thing to go in the pandemic. And we became totally focused in on protecting them from the virus. And yet for many of them, they were languishing behind closed doors in isolation in their rooms. And, for those who did not have COVID, we have definitely seen decline mentally and physically because of the lack of human interaction and the lack of meaningful engagement and activity throughout this long period. And so, we were kind of, for anyone who doesn't work in long-term care, you might be shocked to know how heavily our lives are regulated. For anybody who does work in long-term care, you're used to it. But, so much of our daily lives, right down to the nitty-gritty, has been so regulated since the beginning of COVID by our local or state or national level health departments and, the CMS, Centers for Medicaid and Medicare Services. So we, we're really limited in how much we were able to do to enrich their lives. And unfortunately, there definitely are repercussions to that.
And I just want to say, I've spent some time at your home, and
Yes.
Yesterday was the very first World Day for Grandparents and the Elderly, and Pope Francis instituted this in the church. And he talks about the spiritual fruits that come from the elderly, who continue to be productive in prayer, in love, in presence, and that's really, your homes are an icon of that. You've got the mystical warriors among the elderly who are in your homes, who are praying their children and their grandchildren back into the church, and praying for the rest of us. And so thank you for existing, and thank you for what you're doing.
Thank you very much.
Really an example of what we need more of, what we need to support. And anyone who is joining us, listening in, there's a Q&A box. You're probably familiar with that by now, with all the Zoom events that have gone on and meetings. Feel free to put questions in the Q&A box for our panelists, and I'll weave them into the conversation. With that, Erin Younkins, could you please join us? You're at the Archdiocese of Baltimore, but your specialty before you came there was 2 decades of work in geriatrics and occupational therapy. Can you please talk about, react to what our panelists have said, and include your own insights on this crisis that Charlie's talking about in his book?
Yeah, thank you, Kathyrn, and thank you so much for having me. I reached out to Dr. Camosy about a year ago now, when I heard him talking about throwaway culture, and he was giving this really great lecture. And I said, I just wanted to message him and say, this is what I see all the time. Working in geriatrics for 20 years, I see this sort of like pervasive, challenge that continues to just be swept under the rug. And I'm just so happy that you were talking about it. And so we actually started talking specifically about this dementia population that I had really grown to love. I started working in about 2002, 2001, and I always thought I'd be in pediatrics because I love working with kiddos. But then the more I worked with the older population, the more I really did fall in love with it. And it's a huge gift to be able to work with people who have lived a lifetime. It's especially as a super young therapist. They were so generous with me, and being a therapist is sort of a different perspective when it comes to healthcare than maybe some other specialties, because you're not in and out. You are expected to spend a significant amount of time with them. You're working with patients for 30 to maybe 90 minutes at a time, multiple days a week, and you develop a relationship. And it was just such a gift. I've been in about at least 40 facilities in 3 states. I've worked in Maryland, New York, and North Carolina. And I really felt especially drawn to the dementia population, which is Alzheimer's is, of course, the most popular, but there are several different kinds of dementias. And, you know, I want to make sure that we're paying attention to 2 groups of people when we're discussing this. And the one is certainly been highlighted by this pandemic, as Charlie mentioned, with the way nursing homes are run. There are over 15,000 in our country and almost 30,000 assisted livings. They frankly are not licensed that differently, depending on the state. Assisted livings are licensed by the state, and you have some very high levels of care in assisted living facilities that make it very difficult to differentiate between nursing home and assisted living care. That's over 2 million licensed beds. And yet we have about 6 million people in our country living with it. So we have a huge population that we need to really take a second look at how the logistics of these institutions are progressing, where the resources are. Do we actually have what we need to sustain the numbers that are coming? But then we also have your isolated elderly with dementia still in the community, losing access to socializing, losing access to their religious communities or their parishes, losing access to transportation to get where they need to be. And they're also suffering a great deal of isolation. And it's creating a gigantic challenge to their caregivers, their husbands and wives, their children. And I think that as a church, we really need to look at how do we advocate for people in facilities to make sure that not only our Catholic medical facilities are really leading the way with the highest and best level of care, but how are we helping to advocate for non-Catholic institution residents? And then also, how are we supporting families at our parish level who have to take care of grandma or grandpa or their spouse or their parents? And how are we as a community surrounding those people to make sure that we can meet the needs of all of these folks? It's an extremely vulnerable population, and the numbers will need to be looked at for years to come. But there was a huge increase in deaths for people with dementia over the last 18 months, not due to COVID. Far more deaths than we're used to seeing. And isolation is definitely a big part of that. I'll tell you, it was not uncommon for me to walk into a nursing home or assisted living room of a patient with dementia and see a breakfast tray sitting there untouched.
Yeah.
Because it had just been sat on a table and the person had left. And no one's come in to remind that patient what's there, make sure it's within their line of sight, help them to set up, help them to eat. And then at lunchtime, it just gets taken away and the lunch tray gets put down. And so families were really advocating for those folks. They were coming in, hopefully, unfortunately, the lucky patients, to be fed by their friends or family or additional hired caregivers. A lot of families hire private care for their loved ones in facilities because the level of care is not always good. And since the pandemic, they haven't been allowed to do that. So not eating enough, forgetting to eat, not socializing, those are hugely debilitating cognitively and physically. So, I've seen these issues though since before COVID. I've been in what at the time was the second most expensive facility in the country. And I've been in facilities that shut down when I returned a week later. So I've been in the broad spectrum of, resources, but you do see similar problems from place to place. And I've been in places where, there have been phenomenal, dedicated, wonderful caregivers. But that's some of them that are there. It's not everybody. And it's not always indicative of administration policy priorities. And a lot of these places were 5-star facilities. They got perfect ratings. So, these are issues that are really at the human level. It's more than making a policy. It's more than signing a contract. It's about going in and seeing what's really happening and how people are actually being treated.
Yeah.
Bishop Vann, you were, some of this was resonating very much as Erin was speaking. How do we get to this point? And just as a pastor, how can we think about this differently? Because I know a lot of people hear these facts and just are overwhelmed, and so want to continue to look away. How can we not continue to look away?
I think we have to take every opportunity to reinforce these private conversations, parish seminars, preaching or whatever, just to keep again and again, because people's attention span is not so long, So I think every opportunity we have, which I try to do to reinforce them that this is a challenge, and what are we going to do? How can you be involved,
If people are listening to this and maybe recognizing this problem for the first time in a focused way and starting to ask questions about their own families and their own experiences and their own communities. So often we don't even know, as parishioners in a parish, we don't know the needs and challenges of other people in the pew with us. How should we be looking at this differently? I think too of the beginning of our country, where we had so many women religious who were there taking care of the widows and the orphans, we people have to start thinking a little more creatively, don't they? Because we're part of the church too, in being part of this answer.
Yeah, it seems to me we have to reinforce that it's not somebody else's responsibility. It's ours, mine, yours. The religious communities of women are not there anymore. A lot of it was just they would take care of it. It's my responsibility. I cannot give it off to somebody else, I think.
When he was Archbishop Dolan at the time, Cardinal Dolan was president of the Bishops' Conference. I remember at the closing of one of his addresses, he quoted G.K. Chesterton asking, "What's wrong with the world?" And the answer is me. What more can I be doing? And I do think that's sort of the examination of conscience moment that this pandemic has given us. And Charlie, you in the book don't only talk about the terrible things. You also talk about what we can do to move forward. Can you get into that a little bit?
Yeah, I think it's a particularly important time to think about the fact that so many people now we had a crisis of loneliness before the pandemic. I can't imagine what it's like now.
Right.
Just a desperate need to interact, to have a real embodied relationship with someone, to be at the service of someone else. And I just wonder if this crisis of dementia is coming precisely at the time where people need to be in the relationships we need them to be having with the elderly and people suffering from dementia. And so, yes, it's important for us to work in our own homes and to be around. And I talk a lot about, family and extended family and neighborhoods and communities. And that's, important, full stop. But I wonder if the church can, especially if we're talking about mapping responses, I wonder if the church can be at the forefront of helping people, again, like you said, who are just thinking about this for the first time, reach out to others in real embodied relationships, mutually beneficial, mutually life-giving, mutually energizing, mutually enriching relationships that we've already heard several people talk about. Not just, through the organization of parishes and dioceses, but even through like facilities that you and I and Sister Constance and Erin and Bishop have talked about. Are there facilities that are going unused right now in the church that could be used to facilitate some of these kinds of real, important, significant relationships? To not have people on gurneys outside in the hall, but at the center of a community, right? A church community that welcomes them as fundamentally equal. That's the central focus of my book, is the different populations, prenatal children, those in the persistent vegetative state, and others who have lost their fundamental human equality. This population is on the verge of losing its fundamental human equality if it hasn't already. And so if we really believe that they are our equals, we need to act like it. And these are some of the ways. But I'm I'm just an ivory tower professor. I would like to hear from those on the front lines what they think about these things and see if they're realistic or if they have other ideas.
Kathyrn, if I could add, I think one of the problems is that in our country in general, aging older people have been medicalized, if you will. Our healthcare system is dominated by the acute care medical model rather than a more social model or a holistic model of care, something that OTs are experts at, right, Erin? And so I think to some degree, there are perceptions that you have to be expert to reach out. You have to be trained. You have to know what to do to even, to even reach out a hand and try to be a support to someone at home caring for a loved one, or, to get involved in what might be going on in your local nursing home. So I think the church could do a great service by beginning to break that down, that idea that everything is, that you have to be highly trained, that everything requires specialized skills, and to, maybe develop some educational programs or training so that people realize, oh, I'm just a normal, average, whatever, but I want to help my neighbor, or I want to help my grandparent, or I want to help my mother who's caring for my grandparent. I don't have to have specialized training. It just means being human to people. And even some of the nitty gritty stuff. I mean, I began working as a nursing assistant in a nursing home when I was 17 in the era before there was such a thing as certified nursing assistants. We were just trained on the job. I mean, I was 17 and I was taking elderly people to the bathroom and caring for somebody who had a colostomy bag and those kind of things. You don't have to be professionally trained to do many of the tasks that are necessary in caring for our frail seniors, those with dementia and other frailties. You might need a little bit of training, but you don't need, a high level of professional training. It's just that the way medicine works in our country we're ingrained with that idea, like, oh, I can't do it, leave it to the experts. But there's so much that average people could do.
Erin, you mentioned earlier that you had a lot to gain from working with the elderly, with people who have had a lifetime of experience. That gets to one of the comments in our Q&A box. And again, I encourage questions. Richard points out that he'd like to hear us talk a little bit more about the positive aspects of dementia. My wife has been declining for over 12 years, but this has been perhaps the richest time of our lives. To take one key example, forgetting and ignorance are occasions for a renewed sense of wonder. We go on walks every day, and where I see just another robin, she smiles and points with delight at the wonderful creature, the name of which she cannot remember, of course. Finitude is a blessing, he says. What a beautiful testimony.
Yeah, that is.
And it underscores what you were saying, Sister Constance. This is about human love, right? Just being human with one another. And that's part of the problem, isn't it? The dehumanization that we kind of have across the board, where we see problems, not people,
Right.
And we think we have to have the answer, when it's God's grace that's going to get us through, isn't it, Bishop Vann?
It is. Couple things along with that. When I was in med tech, we used to talk about, well, a CBC or urinary analysis. After a while, you got to think, these are not tests, these are people. So I mean, I learned that lesson later on, and I have a music background. So what I do sometimes with older folks, I can sing. So I'll sing songs that I think that they would remember, and that usually brings a response. Songs from the 20s or 30s. And then just briefly about the whole person care, this trains everybody in a parish, not just specialists, to help with the elderly and those who cannot get out. Here's some of the things that they do. There are 5 modules. The first module is Introduction to Palliative Care, Hospice. The second module is Catholic Moral Teaching. But the third module is Caring for Parishioners along the Continuum of Care, Communication and Volunteer Guidelines. Another module is the parish is a loving community, caring for one another. So that is what we extend to the folks who come to these seminars, these sessions, and they're everybody, not just specialists. That we share this with them so they can share with others.
Erin, what has been some of your experience on the ground with the kind of questions people have about support? What does the church have to offer? In particular, one of the questions is, what are resources for people who want to help a loved one with dementia?
It's a really good question. And also I have to applaud Richard for taking such good care of his wife. And
Yeah.
One of the most beautiful things, if I can digress for 1 second, is seeing really, really dedicated family members, especially spouses. There's something very special about that. Watching a spouse continue to give so much love and dedication to the person that they were married to for so long, even when they don't really remember them or recognize them. And the tenderness of, dementia, someone with dementia who, I would go in to see, and they did not remember me or why I was there, obviously, but I'm so excited to see you. I remember when I was a much younger therapist, I would bend down to say hi and they would touch my face. It was like they just wanted to see someone young and that they just hadn't seen youth for a while. And they would just, sort of pet my face or want to hold my hand. And it was just so special to them because they sit alone for so long. And a lot of patients will love to pet dogs, or when I had babies, I'd bring my little babies in sometimes, while I was still on maternity leave, and nothing makes, an old lady happier than rocking with a baby, or an old man happier for that matter. So there's such a beautiful thing about making sure they're so part of the community and seeing that sort of love and dedication and receiving love from someone who doesn't have their full cognition anymore, but they're so happy to see you and a big smile. I had a patient a long time ago, and every single time I saw her, she'd say, "Hello, how was your holiday?" 365 days a year, it was, "How was your holiday?" And she was just so joyful. And I think it's a really amazing group of people to give up access to them so willingly and just sort of forget about them when they have so much to offer and they give so much back to you. I got paid to be there, so it was my job, but to receive from them what I was able to is it was life-changing for me. I think that in terms of the resources, definitely looking into the professionals within your parish and having parish leadership sort of call to attention, people within their parish who might be nurses or might be therapists or might be social workers, looking at, your home health access. You have therapists that can come out to your home for assessments and training and things like that. I 100% agree with Sister. It does not take a college degree to learn how to sit and maximize someone's function and spend time with them and help them along. Giving some people within your parish a break. A lot of times it's difficult to sort of meet the qualifications or the regulations and standards for volunteering in facilities at a certain capacity. But if you have the time and the willingness to go and give a respite to someone within your home parish, let them get out and shop, let them get out and go to their own appointments, let them get out and go to lunch with friends, and you go and sit with someone. And maybe all you really have to do is help feed them, just make sure you know how to guard them when they're walking with their walker to the restroom, give them little reminders here and there, get them outside for fresh air, which is just, it's such a basic human need that gets overlooked. It really doesn't take too much. Letting them talk to you and tell them stories. A lot of times, those who are even nonverbal, they just really want some human contact, some human touch, listening to some music. It doesn't take, a medical degree to care for someone and to love someone. So, I would say reaching out for occupational therapists, not to plug us too much here, but we are a really great resource for how to overcome challenges and maximize abilities. You know, you'll find that some folks towards the end, later stage dementia, they'll have reflexes return that you have when you're born, but then you lose them, and sometimes they actually return towards the end of the disease progression. And it looks as though that person is maybe resisting care, but really it's a reflex. And OTs are really great at showing you how to interrupt that reflex and instead help them promote participation in whatever the activity is, whatever the self-care or leisure task is. That's a 20-minute training session by a home therapist that can come out and give you some guidance and some assistance. And, you know, I would hope that at a parish level, we can start to encourage that contribution of time and talent. You know, very rarely have I ever heard someone say, we need an occupational therapist here. You know, that's not usually who folks are looking for. But whether it's a teacher, whether it's someone who's been through it before, maybe not a professional, but they took care of their mom for 20 years. For those folks to even say, hey, I'm willing to go out and help you. For folks who maybe that one-on-one individual care is not something they're super comfortable with, but maybe you can help build a ramp outside their house, because maybe that's what's keeping them from being able to go outside to get fresh air because they can't get up and downstairs anymore. Or maybe you can help widen the doorway so they can get their wheelchair in. So if you have more of a construction talents and you're good with tools, you know, being able to arrange a Saturday morning for a few handymen in the parish to go and make a home more accessible, to make life easier for someone who's caring at home. So I think there's a lot that we can do to sort of set up a much more easily accessible way of caring for elderly, because I'm 100% confident we can, because it's what we did forever. It's what we did until 100 years ago. So there is a way to take care of folks regardless of their level of function, and we just need to return to that.
Medicine is Undermining Fundamental Human Equality by Charles Camosy. And we have a question here. How can this discussion help with the problem of underpaying and not having enough staff, and staff who are overworked? Charlie, what can we do to help with this problem? And the fact, as you mentioned in the beginning and in that trailer, people are leaving and not going into geriatrics.
It's a huge problem, and there isn't an easy solution. And again, there's others on this panel who are more equipped to answer that question than I am. But I will say this. One of the things I've been pushing for is for the church and other groups to get behind reimbursing caregiving at home, and for families for whom this would be an option and a better option. It's actually more cost effective to fund that care than it is to fund institutional care. And if we're pro-family, it's hard to imagine a more pro-family sort of thing to use our resources for. On the other side of things, and we have a number of people who've attended this session, I believe, from institutions that work directly in this space. Catholic and other religious institutions, I've been in dialogue with several rabbis after the book came out about this and their own ways of organizing their communities and along these lines. We need to pay our people what they're worth, and to make this a priority. Now, Bishop and others know the financial struggles that many dioceses and parishes have and other institutions have, but again, I just ask us if this is a population equal to every other population, we need to treat them differently, and we need to treat their caregivers with the kind of respect that they deserve in caring for our most vulnerable. And it's not easy, right? We don't have the resources to do everything we want. But one of the things, and I'll finish with this point, one of the key parts of the book and in the argument I make in the book is it's often resource allocation that has pushed us in our throwaway culture to discard certain populations. And that's what's happened. I make the case for brain death, PVS, toddlers like Alfie Evans and Charlie Gard, abortion, obviously. And now here it is with dementia again, and we have a resource allocation problem. We need to put resources into this population if we really think they're fundamentally equal to the rest of us.
How receptive to change have facilities been? What motivates them to change how they care for residents? What are the stakeholders and people of influence for them is one of our questions. Charlie. Oh, go ahead, Sister Constance.
I think to a great degree, what drives change is the regulations, the federal regulations for nursing homes. You're always trying to measure up because you're like, right now we're in what we call our survey window, which means the 3 months out of the year that we know that the state surveyors, well, for us it's city, but can walk in at any minute to do our annual survey. And so it's always been my experience that we have a lot of goodwill in our homes as little sisters. And yet what always gets the top attention is something that would get us in trouble in the survey, or something that, it just seems to get accomplished or seems to get done is what the latest thing is that the surveyors are emphasizing that year. And you can usually find out by networking with other organizations doing the same kind of care. You'll find out one from another. Oh, they got us for this. They looked at this. They're really emphasizing that issue. And so sad as it is, that's often bottom line. I think to some degree, families' expectations and concerns can drive us as well. Yeah, definitely. But I think the major thing driving us is the regulatory guidelines. And so I think it's really critical to support advocacy on the governmental level. Like, for instance, in the nonprofit long-term care sector, there's an organization, Leading Age is the organization that represents nonprofits. And so they do research, they do training, but they also, a big piece of what they do is advocacy. So, for local entities to support whatever advocacy mechanisms they know about, like we rely on the those at Leading Age to be able to effect some change. And like, I know for sure that opening up nursing homes as the pandemic has lessened to some degree, especially this spring. Like, I know that Leading Age wrote a letter to the Centers for Medicare and Medicaid, and it was dated April 24th, saying how the detrimental effects of isolation and are just as bad, if not worse, than the danger of COVID at this point. Therefore, it's time to let families start coming back. And so that was dated April 24th. By Mother's Day weekend, the regulations had changed. And we had gone from not being allowed to let anybody in to being expected to facilitate families coming back in a safe way. And see, what drove that, we had, was the advocacy, and then they got CMS, as we refer to the Centers for Medicaid and Medicare, to change the expectations, the regulations. And then that goes back to the individual facilities or organizations, like, oh, now we have to change because, the regulation says this now. So that's really the reality of what we live in day to day.
One of our commenters here asked, have any of you seen any good implementations or have any ideas about getting young people involved so to combat this isolation that the elderly are experiencing?
Pre-pandemic, yes, definitely. But we're
still have lots of volunteers at your house.
But we're still in the period where we can't really let anybody, too many people into the houses. So that's the limitation right now.
Yes, Bishop Vann, please.
I would have an experience here in Orange County with the Asian population. You know, we have the largest concentration of Vietnamese here outside of Saigon. And they have a great reverence for the elders in the community, much more so than us Anglos, frankly.
Mhm.
And so what they're good about doing is getting, for example, the Eucharistic youth, the young people, to be directly involved with the older folks. So I mean, the Asian culture, the Vietnamese culture in particular, is very good about this.
The Filipinos too.
The Filipinos as well, yes.
Yeah.
And Americans who are born and steeped in this culture, we really do have this problem of productivity, and we need to be moving. And some of what Erin was describing earlier, I mean, people couldn't stay still during the pandemic, right? So to sit with someone and listen to someone who might not be making that much sense, you know, it's hard for the American psyche, isn't it? But it's what we must do as Christians.
Yes.
There's definitely one of the things that we can do, and one of the things that everyone can do. So regardless of how well equipped or not you feel with this population, is to have conversations about your experience, have conversations about meaningful relationships with the elderly in your life. 1 in 3 people gets dementia. This is not something that's, you know, unknown or people aren't familiar with. So that's a gigantic number. And that means certainly people in your family, certainly people in your community. And so I think sharing stories is a big deal. You know, I think that when our society first sort of started brainstorming ideas of how we were going to take care of elderly, particularly elderly who were poor, and particularly post World War II, they weren't bad ideas. And I think that we also maybe need to have some productive, proactive conversations that aren't necessarily looking to place blame, but what do we need to do to course correct? Like we're not really headed in the right direction. And so it's okay to say, this isn't working anymore. We need to do something different now. And, you know, one thing too, that I find, and I've mentioned this to Charlie before, about helping people sort of just look at it from a slightly different perspective is, you know, I think it's easy, especially if your grandparents aged gracefully and it wasn't a big issue for you. Maybe that wasn't such a big deal. Maybe even with your own parents, it hasn't, your family's been blessed, or it hasn't been a big problem. I think for us, we're very good at forgetting about our own mortality, and we're very good at not planning for it. So that's another conversation that we probably need to have. But, you know, it's take a moment to really look at your children or your grandchildren. You will not be there to advocate for them. If we don't affect changes in the way things go now, it's not only elderly or people we feel like can fend for themselves or lives we feel are almost over, but your children will be left in the environment that we create for them, and they will be left alone without any advocates. I can only hope that my children have very devoted spouses and children, and if they don't, I don't know what will happen to them, and I won't be there to help them. And so I really think that we need to see this as a larger problem that's affecting everybody. And that's why it's a life spectrum human dignity issue, because everyone, if you're blessed with a long life, everyone's headed this way. And a third of us will have some form of dementia, and we need to treat people better.
Since we have you experts here, one of our viewers says, my mother is 73 years old and she's gotten a little forgetful, and I personally think she's sad a lot of the time, but she fears going outside. How can I help her so that she doesn't deteriorate? This person also adds, I work full-time in an arch care facility and it can get very hard. Sister Constance, do you have some thoughts there? And this is we have a box full of other questions like that. People concerned, don't know if it's full-on dementia, but want to love and don't know how to do it.
I would say just to try to spend more time with that person and coax them. Sometimes the parental to adult-child relationship can have its own baggage that then complicates the situation when the elder starts to need, you know, more attention. But setting that aside, you know, just to try to spend more time And hey, would you like to go out? Oh, would you like to watch a movie together? There are so many possibilities nowadays with Netflix and all the online services that, people could spend time together watching something worthwhile and then talk about it, cook together. I think a great thing is for, especially with older women who, women in this country tend to outlive men by at least 13 years. So I think there are more widows around than widowers. But, to ask an elder in your family who you might think really needs attention, but flip it and say, could you help me learn how to do this or do that, whether it's knitting or cooking or, a skill that an older gentleman has in a family. So, you're going to benefit because you're going to learn something, but you're also drawing them out of themselves. And they don't need to know that you're doing it kind of for their sake. It can be very mutually beneficial. So that would be my first suggestion, would just be to try to encourage some activity together. The person mentioned that his or her mother was 73 and starting to be a little forgetful. It's also very important to be aware of the signs and symptoms of depression, which is quite prevalent in older people and in seniors can sometimes mask as dementia when really the root cause is depression. So for instance, somebody that young, some memory issues could be really a lack of attentiveness or a lack of concentration. Their attention span could be diminished, all due to depression. So it would be good to have either have a conversation about that or encourage your loved one who you might be a little concerned about to discuss it with their primary care physician, because it might be a case of depression rather than dementia, which could be treated. I'm sure all of us can think of a time when we were either in very intense mourning over the death or loss of someone, or just we have the blahs. They've even said that it's a real phenomenon during COVID to have like brain fog. People who are very high functioning to have brain fog from just being stuck at home, isolated, how long this has been going on. And so think about someone who's older, there's so many things it could be before you jump to the conclusion that someone has dementia or Alzheimer's. I don't know, Erin, does that make sense?
Yeah, no, I think that
From your
makes a lot of
perspective.
sense. And I also think sometimes as you get a little bit older, it's not quite as easy for lots of reasons that you forget about when you're younger, to just hop up and get out. So making sure too that whoever is closest to her mother, whether it's her or maybe a grandchild or whomever, can help and make a plan. Sometimes older folks need a good solid plan before they go out. They're not sure how long their energy is going to last. But incontinence is a very big issue that no one wants to talk about, and there's a lot of fear about being on public with that. So making sure you have a plan. We have all the stuff you need. This is how we're going to get in and out. We can leave after 90 minutes if you don't want to be there. I have a seat for you. Kind of a nice plan to make that person feel like it's going to be fine. Help her put her makeup on if she doesn't put her makeup on. Make sure she has an outfit that she feels like she, looks good in, because once, especially being isolated for so long, there's a big lack of confidence about, can I get up that curb? Is there going to be a railing on the stairs? Are there all these things? And just makes people nervous. And so it just feels like, forget it, I'm not going to go. So make sure you make a good solid plan too. Sometimes that coaxes people and gives them the confidence they need to go.
David here wants us to drill down a little bit more. What are your thoughts on getting better support for people with dementia whose families would like to keep them at home? More support groups for families, better insurance coverage, better home care support. And he makes a point that Charlie makes in the book: the future increase in cases will more likely exceed the capacity of available facilities. Charlie, do you have thoughts on that?
Yeah, well, I know some people during our past and current infrastructure debates said, Charlie's car in the driveway is infrastructure. Let's get him, that fixed up, is kind of dismissing everything as infrastructure. But it's hard to imagine actually a more important infrastructure, especially if we have the views that we do about fundamental human equality and respecting life at its most vulnerable stages. It's hard to imagine a more important aspect of our infrastructure than that which we use to care for our vulnerable elderly, for all the reasons we've been talking about for the last hour or so. And if we don't make a commitment as a culture, as a country, to shore up this infrastructure, and actually we need very important creative minds rethinking it if we're going to, again, meet the population doubling over the next 20 years, it's even scary to think about that happening. But then we do need to focus as well on the infrastructure of the home. And there are so many reasons to think about why the kind of peculiar US American, 1.2 kids and a dog in a huge house kind of model for how families function is so misguided on so many levels, ecological, not least. But here's another reason to think about this. We need to expand the family resources, the family infrastructure, to take care of those in these circumstances. Maybe even the neighborhood or parish infrastructure. I can't tell you how many folks, a lot of people in this call are familiar with this, are dismissive of their own Catholic communities as just the place where they show up for the sacraments. Well, here's one place where a Catholic community could do more than just show up for the sacraments. We could be the kind of infrastructure that we need. So it's an all hands on deck approach. That's what I call for in the book. It's not just any one level, it's all those levels. If we're already in the situation now, we have to act on all these levels if we're not going to have an utter disaster in the next 15 to 20 years.
And as we've seen in the news just today, our population is going down in terms of new people being born. And so there are going to be fewer younger people to take care of us when we're old. And we absolutely have to be thinking about this differently. And there's a real urgency that you raise in your book, Charlie, and thank you for doing that. Bishop Vann, the whole person initiative and the education that you're doing in California, how can we do more of this as a church? I think you're muted. Oh, there you go.
We are doing what we can to kind of spread this whole person care, to let folks know about it. But I also would say, you don't have to wait for that. I mean, it's a wonderful approach. You don't have to wait for somebody to ask you. I used to try to get volunteers in the parish and they'd run away from me on the playground, in the parking lot. Especially in this, if you happen to be in an assisted care facility, visit with the folks who are in the hallway, or just go and say, do you need people to be visited with? Just go and do it. Don't wait to be asked,
There's someone who makes a little comment here that she obviously works in nursing care. She says she picked up a book titled Overcoming Secondary Stress in Medical and Nursing Practice, and it helps with some of the things that are driving people out of the profession. Are there other resources like that, Erin?
They're emerging. So from what I've seen, there's a new term going around that I like it. I think it's accurate. That for a long time we've either attributed some of this or accused folks of burnout instead. Well, it's just burnout. And in a way, even though there's some sympathy there, it also kind of implies that maybe people just need to work a little bit harder or suck it up or sort of, just move on. And the new term is actually moral injury. And it's a frustration, it's an emotional and spiritual frustration with the fact that a lot of folks, most people, the majority of people who go into this field want to give care to people. They care about people. But when you go into work every single day and don't have the equipment people need and don't have the staff to help you out and are asked to stay much longer hours than you should be asked to work, or you're given an assignment of 15 people at once, which is not realistic, and you're getting paid poorly, it just becomes exhausting. And I have to give a lot of credit to folks. A lot of people, they are first upset for the patients and not themselves. they don't pity themselves first. They're frustrated that their hands are tied from being able to give better care. And I think moral injury is a better term for that. I don't know that it's burnout. I see a lot of people working really hard. And I think that we need to put a little bit of friendly pressure on our administrators and the folks, particularly in some of the bigger facility chains, that they're well-bonused administrators to really appreciate the frontline staff that are there, provide them with much better training. It's a very difficult job to do with some of the complexities when you have 15 residents, not only with dementia, but lots of comorbidities, lots of different issues that you need to work with. A lot of facilities don't buy lift equipment that they need, and they rely on staff to lift patients that they shouldn't be lifting. And so there's a lot of things that we can advocate for and ask questions when you're going to tour facilities, ask very specific questions. And these are things that I think at the parish level and the diocesan level, we can start to put together resources that I think some of these questions are targeting, which is what is available to me? What should I ask? What's the process for doing this? And we've put that together pretty well from a death and dying perspective. I think most dioceses have a pretty good hospice initiative where they have a conference in the area. They do a pretty good job of explaining that to folks. But there's a whole period of life before that hospice part kicks in. And I'm not sure that we're really helping to guide people as specifically as we could. Every time I worked with a patient and I would say, hey, did you know you can ask for home care without actually going to the hospital first? It's not a post-discharge service. It's actually something that you're entitled to by Medicare. And 99% of the time they would say, no one ever told me that. So I think that as folks who are informed, being able to compile some pretty basic resources for folks at, like I said, the diocesan level, I think could really make a big impact.
We're running out of time here, so I just wanted to go around one last time, and starting with there's another comment from Richard, who loves his wife so well. He says the political point of his prior question was, we need to portray dementia as a peaceful and beautiful time in order to resist euthanasia. We can't just rely on some rule to love one's neighbor. The demand to stop all suffering is so great that it pushes hard for death. So we must not depict the demented as just suffering. In point of fact, those with dementia normally are not aware of what they've lost, only what they still have, like Erin's example of touching a child. Charlie, do you want to give us some closing thoughts, and then we'll go around for people whose consciences are maybe pinged by this conversation. Also, since we have so many people listening who work in this field, some encouragement for them.
Yeah, I'm particularly interested in what the other panelists have to say, but I'll take this opportunity to say the following. What Richard said is undoubtedly true in many circumstances, and I think it would really benefit, especially young people, to experience that. It's often a totally foreign experience for a young person who lives so much of their life virtually, especially over the last year and a half, but even before that, obviously, who is caught up in this kind of secularized US American idea of what's of value, right? The productivity model of what's valuable, autonomy model of what's valuable, rationality, self-awareness model of what's valuable. These kind of relationships can be and are transformative. And it's coming at a time, again, where this particular young population is just incredibly, desperately, mortally lonely and in need of these relationships, and also spiritually adrift in many, many cases. And so here's a dynamite opportunity for the church to be the church, period, in serving these vulnerable populations, but also reaching out in the spirit of the new evangelization to young people who, for whom this could be a spiritually and very likely would be a spiritually transformative experience, precisely because they would encounter the kind of person that Richard is describing, a kind of person that they just don't encounter in their typical day-to-day life.
And frankly, Charlie, not just spiritually, we seeing these unbelievable numbers about the number of young people who considered killing themselves, seriously considered killing themselves during COVID. I mean, this could literally save some lives as well. Bishop Vann, some closing thoughts on these issues?
You know, part of the challenge with the current culture is that we live in silos or echo chambers, however you want to do that. I think an opportunity is given to us by Pope Francis with this Grandparents' Day. How can we introduce some more young people to some of the older members of our parish to have them spend time together? That's one thing we could do, you know, people like my grandparents' age or that kind of thing. Because many young people don't have that opportunity. So how can I facilitate that?
Sister Constance, closing thoughts?
Well, something that I'd like to mention is how important it is to have a sense of humor and not to have very specific expectations if we're caregiving for those with various stages of dementia. But, you know, to know how to laugh when something is funny, and even if it's tragically funny, you know, and to enjoy the moment as much as possible. And here I'm talking more about at-home caregivers, but yeah, I have an aunt and uncle who are in their 90s now, and my uncle is cognitively intact, but my aunt, who's actually younger, has dementia, and they're being cared for at home by their caregivers that have been hired, but they've been hired not through an agency. You know, they're people that my cousins have trusted, and they do have experience as caregivers, but they're not professionally trained. But things are going well. But the other piece of it is that my cousins and their children are involved on a daily basis. Their children are high school and college age. And there's so much laughter that happens in that house because my aunt says really funny, goofy things, and they know how to laugh at it. They knew how to laugh on Easter when they were trying to get them over to their house, and my uncle fell on the garage floor, and that's as far as they got. And, you know, I went to visit them in May, and I was really in admiration at how much lighter the burden is when you know how to laugh sometimes, and you know how to kind of relativize things. And, you know, so things didn't turn out exactly like you had hoped today, whether it's a dish you're making or someone's clothes matching or, you know, whatever it is, but to know how to just enjoy the moment with others and, yeah, get a laugh out of it. It might sound silly, but, you know, just enjoy being together and to make the best of situations.
Erin, can you give us a final thought in about a minute?
Sure. I would say don't be afraid. Just don't be afraid, you know, to see people to the end. So death, we've made it a really scary thing, but as Catholics, it's really important that we lead the way to set that example that it's not and it shouldn't be. I'm extremely grateful to my parents for having all of my grandparents live with me. 2 of them passed away in the house, one while I was the only one home and I was very young, and the other when I was 16 on Christmas Eve. And my parents didn't shelter me from it. They let me sort of see the whole process and sit with them and hold their hands and talk to them. And I don't regret it at all. I'm very, very thankful for it. And I think it's a disservice to younger generations to try to shield them from the reality of what is and how beautiful it can be. So life, you know, death is a life event, and seeing people to the end is a great opportunity and a great gift.
Thank you, everyone. I want to just take a moment as we're winding down to let you know that later today, you will receive an email with a link to this discussion so that you can share it with others. I think if you've been here for this time, you've really experienced something unique. And so this conversation is one that we hope you will be able take advantage of the opportunity to share that. So that will be coming to you in an email later today. You will also have a chance in the following up this conversation. Some of you may want to interact further with our panelists. So in the follow-up email, you will also be receiving contact information for each of the panelists that you can feel free to reach out to from your own context to explore things further. We do want to also very much mention, we hope that you will be able to get Charlie's book. There's 2 possible ways that you could go about this. If you are looking for it individually, just for your own copy, we would encourage you to go to Amazon or to wherever you usually purchase books to do that. We will send some links for that in the follow-up email. But if you're looking to use this as a resource within your work, within your diocese or your parish, we would encourage you to reach out to us directly at New City Press, because if you want multiple copies, we have all sorts of different discounts and ways that we can work with you to help you bring this really unique tool to your communities and to your workplaces. So the email address is showing now, and it will also be in the follow-up email that you will receive, like I say, later this afternoon. This event could not have happened without the wonderful partnership of our panelists and our co-sponsors. At New City Press, our motto is fostering a culture of unity and dialogue. And this event, with partners from across the continent and from a variety of perspectives on the panel, is a great expression of that goal. So we want to give a big thank you to the Office of Human Life and Dignity at the Archdiocese of San Francisco, to the Public Policy, Respect Life, and Family Life offices of the Archdiocese of New York, to the Life, Justice, and Peace office at the Orange County Diocese, and to the Archdiocese of Baltimore. Also to the ArchCare, the continuing care community of the Archdiocese of New York, and to the Catholic Health Association and National Review Institute. Been great partners to work on with this together. We're grateful for this time. Like I say, keep an eye out for that email, but for now we'll leave it there and have a good rest of your day. Thank you.
Thank you all. God bless you.
Thank you.
Thank you.